Hi all, welcome to the online program of ISRT Rayos125. I am here, Mayajyothi KB, Radiographic Technologist at Astermedcity Hospital, Kochi. Now I am going to give you the basics of MRI and dynamic contrast enhanced perfusion. Let me come to the outline of the basic physics, which include physical phenomena, spatial encoding, image construction, fast scanning, MRI hardware, and on the perfusion we are going to discussing about the types, technique, image acquisition, parameters, pharmacokinetic modeling, K-trans, comparison, merits and demerits, and moreover the conclusion. Let me come to the first point of the physical phenomena, that is spinning. Spin is a rotation of a proton around its own axis. Spinning of a charged particle create electromagnetic field. The spin quantum number is denoted by the letter S. Spin quantum is that describe the intrinsic angular momentum of a proton. For the next precision, precision is a rotation of an axis itself under the influence of an external magnetic field, that is forming a cone. The moment of the axis of rotation of a proton is called precession. Precision precessional frequency is called number of precession of proton per second. The relationship between the precession frequency and external magnetic field is in Larmor equation, that is omega is equal to gyromagnetic ratio into B0, where the omega is equal to precession frequency and gyromagnetic ratio will be particular for the specific or the particular proton, and B0 is the external magnetic field strength. Why hydrogen nucleus? It is abundant in our human body and it is having odd number of protons and having the property of spinning. Coming to the energy level, energy state is not always the same. For the hydrogen, energy state is 2 and the precessional frequency is 42.58 megahertz. On 1.50 it is 64 megahertz and on 3T it is 128 respectively. You can see the chart here. Here I am mentioning some of the protons and the energy states. Sorry for the disturbance. Radio frequency pulse causes the flip angle and also make the proton get in phase. Some of the proton will change energy state also. Here the simplified model of the RF pulse. There are both 90-degree and 180-degree pulse used to excite protons and partial flip. The 180-degree inverts magnetization and the precessional direction. Coming to the T1 relaxation time, the T1 recovery is a longitudinal magnetization. The T1 times refer the interval where the 63% of the longitudinal magnetization is received. After the radio frequency pulse, spin go back to the lowest energy state and spin get out of phase. T1 is also called spin lattice relaxation time. Spin gives energy to the surrounding lattice. T2 relaxation time due to interaction among individual spins, external magnetic field inhomogeneity. T2 and T2 star use 180-degree pulse and refocus, eliminate the effect of external magnetic field. T2 relaxation time or spin lattice relaxation time. T2 relaxation is dephasing. Loss of transverse magnetization. T2 times refers its a time where the only 37% of the original transverse magnetization. T2 is usually much faster than T1. Coming to the pulse sequences, it is followed by 90-degree and 180-degree, and the TR is equal to time to repeat 90-degree pulse, and the T is the time to echo. This is a simplified model of the spin echo sequences. T1 weighted images, very long TR and T1 effect is cancelled, and short TR, T were the T1 weighted image. T2, long TE, T2 weighted image, very short TR, signal intensity is too small. This is a chart showing the frequency and energy and wavelength of the X-ray, visible light, violet, red, and MRI. Coming to the spatial encoding, we are going to discussing about the slice selection gradient, frequency, and phase encoding gradient. The slice selection gradient determines which protons get excited to during the excitation pulse to 90 to 180-degree pulse. Use different RF to excite different slices. It is depends thickness, frequency range, and the gradient. Frequency and phase encoding. The gradient Y gradient to create phase difference among different rows. The phase shift between each rows is 360 by number of rows. Use X gradient when sampling to create different precision among the different column. Phase encoding, it's getting before the readout to generate the pulse shift. This is a filling data space model and the phase encoding. The direction of the slices. The directions of the slices is depend upon the XY is a direction and it's make the orientation of the images. There are three types of gradient. The image orientation is depend upon the gradient. X, Y, Z. For the Y, we are getting the coronal image. For the Z, we are getting the axial, and for the X, we are getting the sagittal. Image construction, we are going to discuss data space and K space. K space is the imaginary space that represents the raw data matrix. It is a stage between the reception of signal and the image formation. The raw data from the K space is used to reconstructed in the series by the Fourier transformations. The maximal signal intensity will be in the center due to refocusing for each row due to different refacing rate of each column. This is a Fourier transformation process. It is a pre-processing of the MR images, split signal into two parts and real and imaginary. The signal is received by the radio frequency coil. We will some of the complex process will get the images by Fourier transformations. Filtered back projection is nothing else. It is eliminating the blurring and the noise of the image, and we'll get the image. Fastest can include multi-slice imaging, fast spin echo imaging, gradient echo, and EPI echo planar imaging. Multi-slice imaging, the TR much longer than TE, put different excitations in the time interval. And the fastest spin echo, the echo train length, different T to different echo refocus timing at the TE we want. Gradient, gradient is recalled echo and the partial flip angle and 180-degree pulse can't be used and another way to refocus. On to the gradient echo, the 180-degree pulse is not using in gradient and most rapid repetitions after the inhomogeneity, dephasing occurring according to the T2 star. EPA is echoplanar imaging, principally used in the diffusion weighted imaging. One of the short multi-shot signal decays rapidly because of the T2 star. FOV is too big, requirement is hard to achieve. This is the MRI hardware, the MRI system. The main components is radio frequency coil, gradient coil, magnet, and the patient table. This is the magnetic bore here, and the radio frequency coils receive and emits a signal, and it's a complex process. Will get the images. This is the picture of the MRI, and this is a gradient coil. This is a giant magnet. It's always putting on. It's a superconducting magnet. Coming to the perfusion, as we know that the perfusion refers the passage of blood from an arterial supply to the venous drainage through the microcirculation. Perfusion is necessary for the nutritive supply to the tissue and for the clearance of the product of metabolism. MR perfusion, which includes dynamic susceptibility contrast, dynamic contrast enhanced, and the arterial spin labeling. DCE perfusion is one of the main perfusion techniques and it is calculating parameters by evaluating T1 shortening. There also refers the permeability of MRI and it gives the information about the physiological tissue characteristic and provide nature of the tissue properties at microvascular level. The T1 technique makes rapid repeat imaging induced by the gadolinium based contrast bolus and injected passing through the tissue. The signal intensity is converted to the relative concentration of the contrast agent. Change in relaxation rate is linearly related to the concentration of the contrast agent and acquisition at the several times. And the complex process model allows the calculation of K-trans. We are going to discuss about the K-trans on the later slides. The technique which includes, we are giving the contrast, gadolinium content contrast. On the adult patients, we are giving some 8 to 12 ml of contrast followed by the 10 to 30 ml of saline flesh. That is 0.1 ml per kg at the flow rate of 2-3 ml seconds. They are usually 2D and 3D. The T1 weighted is 3D fold gradient echo techniques are usually employed. The image acquisition, which includes there are some steps: perform baseline T1 mapping, It is nothing else. We are acquiring some pre-contrast image that is called T1 mapping, and acquire the full MRP images and convert the signal data into the gadolinium concentration, and then determine the vascular input function and perform pharmacokinetic modeling. This is the technique that we are using in the perfusion studies, pharmacokinetic modeling, that we are going to discuss on the later slides. There's a parameters includes the TR will be 4 to 6 milliseconds and TE will be 1 to 3 milliseconds, and the flip angle is 10 to 50 degree and the acceleration factor of 2. The brain, it will brain we are giving thickness of the 5 and it is taking up the time, like it is more than the T2 perfusion, that is 5 breast and prostate, it will take we are giving the thicknesses of equal or less than 3 and 1 square in general, due to for the characterization of the small lesions. T1 weighted spoil gradient recalled echo acquisition techniques should be available. 2D or 3D flash and turbo volumetric interpolator breath hold, that is vibe sequence in Siemens Healthcare, on the GE SBGR, and on the Philips T1 FFE fast field echo. The brain imaging is performed with the intent of the generating tissue perfusion parameters based on the pharmacokinetic modeling. The breast, the breast, it will take 5 to 7 minutes, and the prostate, it will take 5 minutes after the post injections. Coming to the pharmacokinetic analysis technique, the transfer constant K trans, the fractional volume extravascular space is VE, the rate constant KEP, the fractional volume of the plasma space is VP. Quantitative parameters of the DCE, this is a tissue where uh, this is the this is the parenchymal cells, and containing erythrocytes and extracellular space. This is the vessels. Gadolinium contrast residing in the plasma immediately after the injection is assumed to leak across the vascular endothelium into the extracellular space and extravascular space by passive diffusion due to the concentration gradient. The influx mass transfer the gadolinium cations depend upon the blood flow, vascular surface area, and vascular permeability. The corresponding reflex rate of the gadolinium from the extracellular and extravascular space back into the plasma is denoted by the KEP. And the gadolinium contrast does not enter the cells, so its concentration depends upon the dimensional fractional volume of plasma and the extracellular and extravascular space denoted into the diagram. This diagram we can see later on this K transfer. It's most frequently used metrics in the perfusions. It can be different interpretation depending on the blood flow and the permeability. In situations in which there is very high permeability, the flux of gadolinium based contrast agent is limited only by flow, and the scatons mainly reflect blood flow. Whereas if there is a very low permeability, the gadolinium based contrast agents cannot leak easily into the extravascular and extracellular space, and the scatons mainly reflect the permeability. This from the plasma to extravascular and extracellular space, that is scatons, and from the extracellular space to the plasma, that it's denoted by KEP. The contrast evaluation is done by simple visual assessment and semi-quantitative descriptive and full quantitative analysis. Simple visual assessment is that we'll get the clues in wash out rate lesions to provide clues. Dynamic contrast enhancement curve reflect the different anatomic and physiological features. Initial steps upslope of the curve correlates with the tissue blood flow, and its peak height reflect the total blood flow and blood volume. The next portion of the curve is due to the contrast leakage into the tissue and intestine, and this is function of capillary area and the permeability. Late portion of the curve reflect the total tissue of extracellular space and plasma industrial volume. This is the contrast enhancement peak, where this is time and the contrast enhancement. We can see the tissue blood flow, the tissue blood volume, capillary, and the permeability and tissue extracellular space. Semi-quantitative descriptive, the usual useful the compared to the signal intensity changes in the other foreign bodies are normal tissue background. This AUC is equal to area under the contrast curve, and AT is the arrival time, and TTP WOR is a wash out rate. This graph we can see later. Full quantitative analysis. It includes three: conversion of the intensity of the gadolinium concentration, selection of an appropriate tissue model, estimation of the model parameters from the filter data. Important quantitative tissue parameters obtained include vascular permeability, gadolinium exchange rate, blood flow, and the volume of the tissue of the extracellular space. This is the result of post-processing image. The post-processing step will be different on the machines we are acquiring. This is under the Siemens Healthcare applications. Application includes accurate glioma grading is a great importance of the clinical decision making radiologist. DC MRI can difference the catrans and VP between the GBM and melanoma metastasis. Hypervascular metastasis could be differentiated from the GBM using logarithmic slope of the washout phase and AUG. As the vascular permeability in the recurrent HGG differs from the radiation necrosis, showed increased catrans and IAUG is indicating recurrent lesions and decreased values of the radiation injury, where the V and KP held on the differentiating value. This is a case study of the frontal glioma. This we can see the enhancement of the lesions. This is a comparison of the MRP, like both DSE and DC and ASL. ASL, we are not going the contrast. This you can read. Merits includes all the hemorrhages can be seen easily. Small flow radius of the gadolinium contrast involvement is acceptable. Leakage can be seen accurately. Stroke can be found at the earliest. But the demerits include the long acquisition time, partial volume averaging effect, and flow dependency of K-trans. Conclusions: MRI is very powerful and complicated system. There are already many advanced techniques and very useful in imaging technology. Uh, I'm expecting that you guys are clear on my topic. If you get any doubt, you can put your feedback. Thank you.